Hey, what's going on, everybody? Dr. Howie here, and I have Gabe. Say hi to everybody, Gabe.
What's up, guys?
So, Gabe, do you mind sharing with the folks here a little bit about what's been going on? I believe you're a college swimmer currently right now.
Yeah, so preparing for conference next week. That's our big meet of the season. So right now, this week, we are fully tapering. But in the previous 3 days, I'd say, I've been feeling discomfort and pain here in my shoulder and my elbow, on my left arm especially, and then a little bit on my right side. And one more thing is that I don't know if this is from working out or if this is from my sleeping position, but I've just been feeling pain in my neck on both sides down to the shoulder and mid-neck. It's been limiting my range of motion a little bit, so there's that.
Absolutely. So we're prepping for conference. That's next week. He's tapering right now. So for you NARPs out there, non-athletic regular people, tapering is a concept where as an athlete, if you're nearing your competition date, you start to bring down the physical activity a little bit just so your body can start recovering so that when you get to the meet conference next week, you can be at its most optimal shape. But now hearing Gabe that past few days, he's been dealing with some issues down his upper extremities, especially the neck. I'm just curious, Gabe, has this kind of creating some kind of mental stress for you in terms of thinking about your competition next week?
A little bit, yeah. I mean, in previous meets when I've been feeling this, I haven't been feeling as confident, and I've felt that in my race too. Like I've been hyper-focusing on making sure that I don't like tweak my elbow or tweak my shoulder. So, I mean, that's in the books.
Absolutely. And so you can imagine it's super frustrating as an athlete putting in weeks, months, even years of work in a sport like swimming where even just dropping 0.1 seconds is a big win, right? So we want to be able to help Gabe be able to swim next week at conference without any physical discomfort or pains so that he's not having that mental stress or block in terms of trying to protect the areas. And so that's going to be our biggest intention for you today. How's that sound?
It sounds amazing.
All right, cool. So do me a favor, before we do anything, Gabe, just sit up nice and tall for me. Sit up nice and tall. And the first thing what I want to do is you mentioned a little bit about what's going with the left elbow. So just kind of move it around left and right. And just what did you notice as we're moving around here?
It just cracked right here when I went like this.
Okay. Any pain or discomfort in any of these positions here?
Not really, just kind of like a click.
Kind of feel it clicking.
Yeah.
Okay, cool. You can go and relax that. Now let's take a look at kind of your neck overall range of motion here. So sit up tall, and what I want you to do is just bring the head down, look down as far as you can go. And is there any pain or tightness associated with that?
Right here.
Right there on the right side.
And then a little bit right here.
All right, so more on the right, a little bit on the left. Go ahead and look up to the sky for me and talk to me. How does that feel there?
This feels fine.
That feels just fine. Come back to neutral for me. And now what I want you to do is rotate the head, look over the shoulder, right?
Yep.
Okay, how does that feel there?
Tightness here.
Tightness on the right side. Let's go the other way for me.
Tightness here on the right. And
All
on the
right.
left.
So it seems like right is something that we hear a lot more. There is some boo-boo there on the left side as well. Okay. Finally, from here, Gabe, I want you to laterally bend the head, drop the ear to the shoulder. Talk to me. How does it feel going left?
Left side's a little bit tight.
Okay.
It feels like, and then the right side is all of this. That's like, it feels like it's a stretch.
All right. Let's go the other way for me then.
Same thing, more so of a stretch here. Not anything here though.
All right, awesome. So what we're gonna have you do here, we do have some limitations with the neck in terms of range of motion. There are pain and discomfort associated with that. So let's get to work. Let's see if we can come out of here today feeling much better in the neck and elbow area, okay? So we're gonna have you on your back face up here for me, on your back face up. Stay nice and relaxed. So now typically what happens if we have the patient go face up on the table, the body can now actually relax a little bit because now we're not holding ourselves against gravity. And so just a quick check from us, Gabe, is let's just rotate the head one more time while you're laying there. Turn to the right and turn to the left.
Tightness on when I turn it to the right on the
Okay.
right side. Left, it transfers to the left.
Got it, cool. Do you feel any slight improvement there from seated to sitting up, laying on your back? It's okay if there isn't. It's okay if there isn't.
I don't think there is any.
All good. So we're still seeing that as he's on his back, we have some pain and limitations here. So let's get moving here. Before we start, Gabe, here's what I want to do. Let's just take a moment here. 1 minute. One hand on your belly, one hand on your chest. Okay. And I want you to inhale through the nose, but when we do this, I want you to think about two-part breath. We're breathing into the belly first. Let the belly inflate. Then bring it up the chest. Good. Breathe it out the mouth. All right, great job. So you got the hand here. Let the belly rise on the inhale. Bring it up the chest. There you go. Breathe it out for me. Give me 5 more of those, Gabe. 5 more. Belly first. Chest. Bring it up, up, up. And holding that as you exhale out. Good. 4 more. Breathing that in. Up the chest. Letting that go out the mouth. Good. 3 more. As you notice that as Gabe is going through our decompression breath here, he is allowing his body to decompress with each breath here. Good. And we're going to help his body start to go more in that parasympathetic rest and digest mode. Because as you know, we kind of talked about earlier, we kind of have that like stress, tension, a little bit of anxiety thinking about some of the pains and discomforts we're having in terms of bringing that to the performance next week. Let's go 1 more here, Gabe. Up, and let's let that go for me. All right. Just kind of checking in. Anything you've noticed that's different with your body here, just when taking those breaths?
A lot more relaxed.
A lot more relaxed, okay.
Feel more calm, sense of mind.
Awesome, relaxed, calm, just from taking these decompression breaths. So absolutely, we're helping the system open up, helping the body relax. Definitely go into kind of that rest and digest mode there, right? Okay, before we move along, just do me a quick favor. We took a moment to breathe there. Let's rotate the head 1 more time to the right, to the left. Let's see if there's any improvement or not.
There is a little bit of improvement there.
Great, let's go the other way. I think we have a little bit more range now. There we go, great.
A lot more range.
A lot more range, so we improved in range. How does the muscle feel in terms of tightness, tension, and discomfort?
A lot less tense.
A lot less tense. Great, guys. This is what healing is all about, right? It's not so much the practitioner create an external force on the body to create that healing process, but allowing the person on the table to relax the system, allow it to actually have this portal of healing that we can go into. And as you guys saw, that is just from 1 minute of breathing, just like that. Stoked, Gabe, let's keep going, shall we?
All right.
Awesome. All right, stay right there for me. All right, Gabe, stay right there for me. We just take a look at leg length right here. That left leg is a lot shorter. So we're gonna put some supine blocks on Gabe here to get him going here. Gabe, same thing, just go back to that decompression breath, breathe belly to chest. And we're gonna bring that down. Here we are, bend that leg for me, good. Bring that over this way. There. And keep breathing here, 3 more breaths. We're just gonna help the hips open up slightly here. Great, I'm gonna hold that on the right. Left is gonna be held there. Good job, give me 2 more. Great, give me 1 last one. All right, let's take a moment here. Let's check the neck 1 more time. Rotate right, rotate left. Let's see what we got.
All right, that feels good.
Mm-hmm.
That feels good too. I'm feeling less pain there.
Great, okay.
None at all, actually.
Not at all. Great. So, wow. I mean, I'll take that any day, right? So, we're just kind of building the pieces here because this is also allowing Gabe to kind of see like, even though the pain is in the neck, is it really a neck issue or is it just how the rest of the body is compensating throughout, right? So we took that moment, we took that decompression breath, we allowed Gabe to continue that decompression breath, and now we added in our SOT blocks here to help pelvis be in a better position, and voila, even now we see improvement in range, and even then he's saying when he turns to the left, there's no more pain there. That's super exciting. All right, let's continue, shall we?
Right.
Okay, so you're there. All right, so when we're looking at chains, right? Shout out Anatomy Trains, Thomas Myers. But we're looking at different types of lines, which is the superficial back line, even the deep frontal line. But regardless of which line we're talking about, most of the chains all kind of insert down to the feet. So it's really important that we always check the feet, see how they're moving. They move really well here side by side. Inversion, eversion looks great. He's already kind of stuck in that plantar flexion, that's fine. Let's see how dorsiflexion is. So his foot actually feels really solid. But I do feel as we're coming up in dorsiflexion, he should have a little bit more range, so that talus up here is a little bit more stuck. And I would see that sometimes in some swimmers because of some of the fins, like when we wear fins and some of the work that we do with fins, because the fins, they don't come up like the shoes, they come like a little bit more forward here in terms of the cutout. And because with fins, there's gonna create more resistance in the water. It's gonna have to have your talus be able to move up and down a little bit smoother. So I do feel that a lot of swimmers, especially when they do some fins work, their talus is going to be a little bit more stuck. So let's bring that up for you, buddy. And we're just gonna pull that through. There you go. Do the same thing here. Through. Nicely done. Cool. We adjusted the foot there. Pelvic blocks are in. He's doing a really good job of doing that decompression breath. Let's just see, Gabe, if you're turning your neck one more time, let's see how that looks.
That feels good.
That feels great. Let's go left.
Same thing there.
Nice. We're done. Just kidding. All right. Awesome. Super exciting to see just from these little adjustments, right? Like the healing really comes from within, right? So really helping your body be able to get that situated. When you're ready, Gabe, here's what you're gonna do is you're gonna roll on your side, face me this way. Funny how we know that. All right, here we are. And just bring that shoulder out a little bit forward for me. Yeah, you can lay your head all the way down. Yes, sir, and we'll bend the elbow here, elbow, elbow. All right, as a college student, remember those that went to college, remember how much smaller the seats are compared to high school and middle school, right? And you got a high-level athlete like Gabe, those seats aren't meant for athletes to be on, right? They're a lot smaller, and so we would imagine that a lot of us here are gonna have that low back to mid-back tension because of how small the seats are in college. So I definitely feel a lot of restriction here in his pelvis and low back. So let's go ahead and help Gabe out here. We're gonna compress through, roll. I got you, Gabe. Never dropped anybody before. I got you. I got you. Good job. Let's roll the other way for me. All right. Same thing this way. You're just gonna feel my forearm now on that side. And let's go. There you go. Feel that relief. Breathe that in, especially this area there. Big breath, big breath. Yep, let that go. All right, do me a favor, buddy, on your back. Right. Cool. We're just making our way up towards the head, towards the area of his complaint. You want to know what I love about Gabe? Already putting hand on belly, hand on chest, going right back into that decompression breath. And let's just do us another favor here. Let's turn the head one more time. Let's see how that looks.
Still feels pretty good.
Still feels pretty good. Okay. We're just going to move our way up the spine, okay? All right. Give that a hug for me. Here's what we're going to do is you're going to just bring this arm out, hug the pillow with the right arm. I'm going to come in. You're just going to give me a hug with this left arm. Okay. All right? Cool. Go ahead. Hug me like you mean it, Gabe. There you go. All right, coming in. Here's that mid back. Now come through. 3, 2, 1. Oh. Nicely done. All right, cool. Same thing. We're gonna hug with the left arm. You're gonna hug me with the right arm. Okay. So give me a hug like you mean it. We're gonna roll that over. And in this one, we can kind of do like a 1-2 punch here. We can hit the spine as well as the rib, and that's gonna give him all that relief. So here we are, Gabe. I got you. 3, 2, 1. Take a moment there, breathing that in. And if you feel like you're comfortable with the belly and chest breathing, you don't have to put your hands there anymore. There it is. All right, we adjust it. We're making our way up, right? Let's take a look at the neck one more time, turning to the right. That looks like there's a lot more range now. Talk to me, Gabe. How are we doing?
Feeling no tension. That right side, I noticed a noticeable, like, I'm able to turn a little bit more on that. So, yeah, I can, like, just by, like, feeling my back too, it feels a lot less tense, a lot looser.
Awesome, awesome. We're not done yet. We're gonna keep going, okay? Swimmers and shoulders. I can't tell you how many times I've heard swimmers with shoulder pain, so we gotta make sure we are taking care of Gabe's shoulders here. So now, just kind of looking visually, right? If we're looking at these two shoulders, you can tell that this left one is slightly higher than the right if I'm just kind of pushing down this way. If we're down that, like inferiorly, if we're pushing posteriorly, we can see that the right shoulder is a little bit more forward. So there you got two opposing forces here. Correct me if I'm wrong. This is the side that you feel the little elbow issue, right?
Yes.
Left side. Okay, so that is a little bit higher. And so we do have an adjustment here more specifically on the shoulders, but just remembering for me really is when I'm adjusting this left shoulder, we're trying to bring it from superior to inferior. Whereas when I'm adjusting this right shoulder, we're bringing it from anterior to posterior, all right? So the setup is gonna look the same, but the vector is gonna be a little bit different. So let's start with this right side, all right? So your right arm, Gabe, you're gonna just right hand cup your ear, elbow to the sky.
All right.
Good, 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 I got you. Just close that in. You're gonna keep this nice and relaxed for me. Good. And now I'm gonna come into your armpit. I got you, and just try to keep that elbow relaxed. Yep, yep, yep. And I'm gonna just bring that straight back. Good, keep it relaxed, relaxed, relaxed. Nice job. We're gonna go here. There. Now I'm gonna bring that from up to down. So I got you, Gabe. Again, try to keep that nice and relaxed. Bring it that down. There you go. All right. Let's check that elbow. There it is. And with the wrist. Nicely done. Good movements there. Boom, boom, boom. Now, do me a quick favor, buddy. Let's have you go face down for me.
All right. Oh, that feels already a lot better there.
A lot better.
Yeah.
All right, awesome. Come on down for me. Hands right there. Awesome. You're doing great. You're doing great. Just palpating through. He's saying there's a lot of improvement there on the left side. There is some muscular tension here on those traps. So let's just kind of palpate through. And you can see here, this left side's got a lot more give as I'm pushing through. You see how the rest of his body is moving, even his feet. When we come in on this right side, and there's just less movement that comes through. We can still see how the legs move, but there's just definitely less movement compared to this side. So let's take a look at how his head's situated. Definitely a lot more tension here on that right side. And what we want to do is kind of open up that side. So I got you, Gabe. Don't help me. We're going to be here. Rotating that through. I got you, Gabe. We're going to open up that right side. Nicely done.
Oh, that's nice.
So a lot more give on this. Let me now repalpate. I'm going to hit this left side now. Good job. Come on off. Do me one last favor on your back.
All right.
Okay. Take a few moments to breathe, and we're going to do one last check with the head going right and left. All right, go and turn right for me. Wow.
Yeah, that's nice.
Let's go the other way.
Same thing there.
Awesome.
But definitely that right side, a lot less tension there. It feels open.
Great. So we have one last move here because we actually haven't even adjusted Gabe's neck, really the cervical spine. We adjusted just now the cervical thoracic spine. And so again, our intention is always be precise, be specific. We're not trying to just blow up the entire region here. And so Gabe, one more time for me, when you're turning your head right and left, when you turn right, what are you noticing here? Tension, discomfort, where?
I mean, the lower tension is completely gone.
Okay.
There's a little bit right here.
Okay, when you're turning right, there's a little bit right there. No problem. Let's go to the left now.
It's existent still here, and then the lower one is not there, but it's more so up here.
Upper. All right. Gotcha. So that is super helpful in what he has given us for feedback, because then we want to adjust him in that direction. Okay, so I'm just making sure as I'm palpating through that I also feel what Gabe is feeling. There. Okay. So, on this side, on the right side, when Gabe rotates to the right, he's noticing restriction, tightness there on that right side. So, what we want to do is adjust him into that direction rather than pulling him out. I know the sneeze coming. Okay. And so what we want is Gabe reporting that when he rotates to the right, that there is still a little bit of discomfort here in the middle here, about C4 or C5. And so when we adjust, we want to make sure that we are helping him improve that movement, which is into a right rotation. So the question is, how do you then adjust the right side of the neck with right rotation? Because typically when we adjust the right side, it is with a left rotation. So I'm gonna have my index finger just right on that mid neck area. Turn Gabe over this way, and my right arm is gonna come back towards me. This hand, I'm not really adjusting anything, I'm just kind of holding that for support. So the force is gonna come from that right side. Take a moment there. Now, let's turn right for me. Let's see how that feels. Whew.
No discomfort at all.
Great.
That one's gone.
Cool. Now let's turn left. Let's see what we got here going left.
Still on the left side,
Okay.
but same spot,
Same spot.
but nothing on the right.
Got it. All right. So kind of the same idea right now. We got to do the same thing on that left side. So just again, palpating through, making sure we got the right segment. Okay, so it is a little higher. This is more like C2, C3. And so for me, going to be a little bit more finesse there. So I'm actually going to have to use my thumb to contact that. I'm going to bring that around. And when I actually use this other hand to kind of help that rotation over, but the same thing, my left hand's gonna come back towards me to get that left side moving. Ooh. All right, let's do a final check here. Let's see if we cleared it all. So turn to the right, let's see what we got.
Yep, nothing, no pain or discomfort there at all, actually.
Great, let's go to the left.
That upper pain is gone.
Great. Come back to neutral for me. All right, cool. Sit up nice and tall for me, Gabe. Wow, I don't know if we can compare what he used to look like sitting down, but he like grew a few inches here, which is exciting. But let's just take a look at a few things. We just saw as we're moving along, neck has definitely improved a little bit here, but let's just go through some ranges of motion and see what that feels like, okay? So Go ahead and look down as far as you can go for me. How does that feel?
Feels good.
Absolutely, looking up for me.
Yeah.
Great, back to neutral. Let's rotate the head. I know you've done this several times already. That is already a big improvement in range. I'll take that. Let's go the other way. Phenomenal. Got back to neutral, and let's drop the ear laterally. Definitely more there. Let's go other way. Awesome. Now, last piece is kind of the elbow. It's just feeling out some weird clickiness, right? But let's just take a look at that. Let's see how that feels. I just kind of moving that around.
The clickiness is gone there. Yeah, feels smooth.
Great. Awesome. All right, Gabe. So we're able to see sort of the improvements there from a functional standpoint, but let's just quickly check in. How was that experience for you? Walk me through that here.
So it was pretty calming. Like after we were doing that decompression breathing, I felt so much more relaxed, and especially with like hearing all those bones cracking too. That's a satisfying thing to hear, but also I felt my body just go completely loose. Like the tension there just gone. And over time with the checking that range of movement, I was feeling less and less discomfort there. My upper neck on the right side, I was barely noticing it, but over time I started to notice that a bit more. That's why I was able to tell you where that one was. But overall, 10 out of 10.
I love it. Love to hear that. I love to hear that. One of the things that we really try to encourage folks when they come in, whether or not they are someone that really enjoys the adjustments or someone that's like, don't even do that, don't touch me, The whole concept here is creating a safe, beautiful place for you to feel safe, to be heard, to be seen, getting your needs met, and being able to just allowing yourself to just breathing that through. If you can ultimately allow yourself to relax into our parasympathetic mode, right, then the adjustments, doesn't matter if it's a big pop or a small pop, they're all just gonna help you open up the system, open up in areas that you need to be opened up in. And as you can see, not only is there improvement in function, but overall feeling nice and relaxed.
Yeah.
Anything else you wanna add, Gabe, before we say goodbye?
Go visit Dr. Howie at Golden Gate Chiropractic.
All right, my man, you are definitely ready for conference next week. Let us know if there's any way we can help you. All right, and we have some exercises, the breath work right now we're gonna send your way. So best of luck at conference, my man. It's good